This program is brought to you by the Ministry of Education and Vocational Training Zanzibar in collaboration with Good Neighbors. The program is funded by COICA.
Dear listener, you may learn many useful concepts of biology in this program as far as you pay attention. However, our program today is special for Form 2 biology learners. The program will provide free discussion on the genetics. A. The importance of providing care and support to people living with HIV and AIDS. The importance of providing care and support to people living with HIV and AIDS. B. Necessary care and support services to be provided to the people living with HIV and AIDS. Necessary care and support services to be given to the people living with HIV and AIDS. And C. The effects of discrimination and stigmatization to people living with HIV and AIDS, either individual, family, or society. The effects of discrimination and stigmatization to people living with HIV and AIDS, either individual, family, or society. Self-assessment is allowed when the program is going on. For our lovely teacher, this program will help you to prepare a simple lesson for your students so that they will learn with joy and improve their performance.
Check your watch, Salma. I think we are late.
No, I don't think so. We are on time.
We will see, but according to her, they have an appointment with other Shahia also.
But why did they plan like that? To me, I think it was much better to put only one Shahia a day.
Oh, you see, we are very late, Salma.
Oh, let us stand back, Musa. I feel shy with Madam Guest.
No, Salma. To be late is better than absent. Let's go, my friend.
Okay, but let's sit over here, not in front.
Worry out.
So, I think you have now understood why it is important to provide care and support to the people who live with HIV and AIDS.
Yes!
Also, you are familiar with necessary care and support services to be provided to those people as we discussed, right?
Yes!
And lastly, we have proved the effects of discrimination and stigma to those people who live with HIV and AIDS, individually and socially, right?
Yes!
So now this is a time of discussing our issues through your questions. And for those who arrived late, I think this is a suitable time to gain what they missed at the beginning.
Exactly.
So if you are ready, please raise up your hand and go straight to your question. Mr. B will lead the selection.
Okay. Salma, what is your question?
Sorry, why is it important to provide care to the people who live with HIV and AIDS instead of encouraging them to take prevention?
Oh, excuse me, Salma. Can you repeat your question, please?
Yeah. Why is it important to provide care to the people who live with HIV and AIDS instead of encouraging them to take prevention?
There are many reasons, but one is that to segregate them can be the reason of spreading the disease.
Affected people are also humans, so they need all human rights.
But I think it is important to emphasize both, providing care and prevention education to all.
You are right. and that is a government strategy on HIV and AIDS.
Other questions? Salma, I saw your hand.
How can we care and support them?
Good question. There are different ways to follow so as to care and support the affected people with HIV and AIDS. First of all, we should give them a balanced diet.
All right.
Secondly, to stay close with affected people with HIV and AIDS in order to make them live healthy lives for a long time.
That is very important. Any other question?
You said to give them balanced diet.
That's right.
Do you mean different food in good proportion?
Not only that, but also allowing them to rest when they feel unwell.
Sorry, madam. What about taking them to the hospital?
Very good. It is important to take them a health facility as soon as they start developing symptoms of illness. Yeah. Moreover, for youth, taking them to centers that provide HIV and AIDS information and medical care.
All right. Musa.
Yes?
I see your hand.
Yes. Sorry, madam. Do people who live with HIV and AIDS can have partners?
Of course. And their partners will obviously help them to stop behaviors that could worsen the condition. For example, use of narcotics or having many sexual partners.
I get your point, madam.
All right. Salma, what is your question?
Are there any drugs that can give relief to HIV and AIDS infected person?
You see, that is the problem of being late. Madam has talked a lot about that.
I'm sorry.
No problem. Yes, there are special drugs.
Thank you, madam.
Sorry, can we know the name of the drugs?
Yes, it is called ARV drugs, which slow down the HIV progression and severity.
Oh my god. I didn't know that there is such a thing.
There is, and it is helping them to keep their bodies, clothing, and bedding clean.
Really?
Yes, and cleanliness makes a person healthier.
Madam, why the government didn't prepare a special place for people living with HIV and AIDS?
Sorry, Mr. B. Can you help them with that question?
That question already discussed, madam. They waste out time.
No, it is not possible.
Sorry, I have postponed the meeting at another village. So I have half an hour more for you. What I would like to advise you is to care and support people who are living with HIV and AIDS by giving them hope and good health.
All right. To prepare special places for them is against human rights. They have the rights to interact with others.
Actually, we should avoid discriminating or stigmatizing them in various ways.
Okay, Salma, come on.
Thank you. How can affected people be stigmatized?
Oh, Musa, do you want to answer?
I think staying away from them is an example of stigmatizing them.
Excellent.
Thank you.
Can I try to?
Yes, you can.
Refusing to share utensils or room with them.
Wow, nice. That is another type of stigmatizing them. And do you think that there are people who perform that behavior?
Yes,
there are.
Oh, so what shall we do to avoid that bad behavior?
I think that is a matter of government laws and regulations.
Yeah. Also, affected people can be discriminated by labeling them with bad names.
That is a part of stigmatization as well. We should call them by their normal names.
Oh, humiliation.
Yeah. In some societies, affected people are denied education or healthy services.
Oh, that's so bad.
So, these people need to be treated as any other human you know.
Yes, and we have to involve them in decision making.
I understand.
Sorry, madam. I heard that some people hide people living with HIV and AIDS from the public. Don't they?
Some people do. Anyways, I think we had enough discussion. Am I right?
Yes.
What I would like to advise you is to care and support to people living with HIV and AIDS by giving them hope and good health.
Exactly.
Next.
We have to give them a positive support to work and live long life.
Thanks, madam. We shall try our best to give them peace of mind.
Well done. The time is running.
Absolutely right, madam.
Let us listen to a few questions before we close the meeting.
Okay.
Yeah, right. Musa?
What I want to ask is, can discrimination and stigmatization affect people living with HIV and AIDS?
Yeah, of course. Selma,
Yes?
do you wish to say something?
Yes, I do.
Please.
Discrimination and stigmatization may cause poor performance at work and failure at life.
Exactly. Musa?
Also, loneliness and poor health.
Very good.
Thank you.
So, Mr. B,
Yes?
do you wish to offer a last message to our audience?
Just to thank them for giving us their time. Thank you very much.
Yes. Selma or Musa on behalf.
Yeah. We have to thank God for this special knowledge of life.
I think that is enough for today. Thank you all and goodbye.
Soma, soma mwana soma, uwe mjini. Soma, soma mwana soma, uwe kijijini. Soma, soma mwana soma, ukiwa na mahitaji maalum. Soma, soma mwana soma.
Thank you, Madam Guess and Mr. B, and thank you, Salma and Musa, for keeping us aware of care and support for people living with HIV and AIDS. As usual, the discussion was so fruitful. Hopefully, our dear listener have enjoyed and gained a lot. Now, here are the questions about the topic for further discussion. Number 1. Shortly explain the importance of proper and early health care for the people living with HIV and AIDS. Shortly explain the importance of proper and early health care for the people living with HIV and AIDS. Number 2. Using examples, mention 3 ways in which people living with HIV and AIDS are stigmatized in the society. Using examples, mention 3 ways in which people living with HIV and AIDS are stigmatized in the society. Here is the end of this program, but you're so welcomed in the next program. Until next time, bye.
Happy, 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 happy. Radio class. Happy, 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 happy. Yeah. You can be a pilot, you can be a doctor, you can be a soldier, you can be a lawyer,